Can you describe your first meeting with Dr. Shu at Veterinary Specialty Center?
Dr. Kai went over all of the treatment options, whether we just did prednisone, which would kind of just extend his life another month, perhaps. And then he mentioned the CHOP protocol, which is a chemotherapy. And so immediately in my mind, when I heard chemotherapy, I went to the human experience of chemotherapy, and I've been through it, and I watched my dad go through it. And there was no way, no matter how good and great the risks or how good the prognosis could be, in my mind at that point I was going to put my dog through that. One of the first things that Dr. Kai said was, there's no way we'd ever put an animal through that. That's inhumane. And so all of a sudden I was listening to what he had to say, because that was my premise. So if my premise was gone, then all of a sudden chemotherapy was an option. And so he described that the quality of life doesn't get worse when you're on chemotherapy. Basically, we want to stall the cancer, take it down, knock it down in its aggressivity, and hopefully extend his life and elevate his quality of life from what he's experiencing right now.
And what was the prognosis that Dr. Shu gave you?
We were hoping for a year. That was the best case scenario, or longer, but Dr. Kai made it clear that some dogs don't do quite as well, while other dogs do much better. So we were just hoping for the best.
Can you describe a typical treatment visit to the clinic?
The first couple of times we came back for his treatments, he was a little reticent to come in the door. He's very hesitant about the clinical environment. But now, after the last 10 treatments, he pulls on his leash to get in here. He whacks his tail against everything to greet everybody, gives everyone smooches. And it just makes me feel really good that he likes coming back here to get his treatment. So what we usually do, we come in, Kelly, our technician, usually takes badge and gets a weight for him and takes his temperature, just kind of checks him overall, checks in with me to see how he was doing the past week. And then they take his blood just to make sure all his counts are okay and that he's strong enough to receive the chemotherapy for that week. So they would take him back, and depending on the drug, the injection would take anywhere for another 20 to 30 minutes. And then he would come back out with a little bright blue Band-Aid on his leg, and Dr. Kai would walk through the potential, the first round of each drug. He walked us through the potential side effects, things to watch for. Then we'd get our discharge papers where all that was written out in case I forgot anything, and be on our way.
And how was Badge while being on chemotherapy?
He was back to his 9-year-old puppy self. Honestly, we realized at that point how much his quality of life had deteriorated while he was sick, because he became much more puppy-like, his extraordinarily playful self again. He was engaged, he was social, he didn't retreat back to his room. No, so he was, the whole time he was on chemotherapy, he was his happy, playful self. So it's elevated his quality of life, which has elevated my quality of life. And for that reason, it was worth it.
Knowing what you've been through, would you do it again?
No hesitation. I would do it again for several reasons. One, it was a great experience for Badge. Like, he felt better than he had felt the last few months before he was diagnosed, so it was worth it for that. When I imagined the absence of him when he was first diagnosed, I couldn't wrap my head around it. So I've been able to appreciate every day of his life since then. And now I still am able to not take him for granted, appreciate every time he wags his tail, every time he opens his mouth in a grin, and it was worth every penny. And even if I had known at the very beginning that it would only be for maybe 5 months of remission, I would do it again.